Gonzalo, thank you for joining me today.
Thank you.
You have done a lot of pretty pioneering work in online communities and online support communities.
Right.
Can you talk a little bit about why that's so important and how it fits into Medicine X?
Right. Well, the work that I'd done, it was basically a research that we did in the Basque country in Spain. So they set up about 3 or 4 years ago. They had a whole plan to address the problem with chronic illness. You know, as we age and we live longer, the health system will face more people that have chronic illness and multiple chronic illness. So in Spain, where healthcare is universal, the cost they were just skyrocketing. So there were a lot of initiatives, and one of those was, can we offer a virtual community for people who have multiple chronic illness to figure out how to, support themselves, provide information, know where some of the resources were, and in a way help not to tax or to burden the health system, because people, for anything, they were going to the doctor, the primary care doctor. But I think that the most important piece was that it was not driven by the technology. It was really driven by sort of a larger strategy to address the cost of caring for a lot of people.
So ultimately, do you see this as something that can help bring down costs?
Yeah, absolutely. Not only, cost is an important motivator for government if you're offering healthcare. But obviously there are ways in which communities provide sort of like other kinds of benefits in terms of empowering patients and in terms of what people call activating them. And basically the assumption is that if you're an informed patient and you have some support, that you're going to be much more assertive and much more effective when you're with your doctor. And now, the interesting thing, one of the things that we found is that people did not necessarily talk too much about illness. They talk all kinds. It almost became like a Facebook kind of thing, environment. But what it did happen after some time was that a lot of the Basque country is pretty distributed. I mean, there's a lot of rural areas, there's small towns. But one of the things that did happen was that people started to have some activities out in real life. So a lot of folks start to getting to know directly. They will get together at a restaurant or some other place or have a coffee. And so somehow, some of what I think is important is that it is distributed or it's global. It doesn't mean that it doesn't support some of the local relationships, in real life relationships. Mm-hmm.
It's fascinating. Mm-hmm. Thank you so much for speaking with me today.
Thank you. All right.